Hi everybody, welcome to the Dr. Mom Show. It's Dr. D, mom of three. So excited that you're joining me again for this show. Don't forget to subscribe to the Dr. Mom Show's channel. Again, tonight I'm very excited because tomorrow is Happy World Health Day. Whoop whoop to good health. So today I'll be talking a little bit about preventative care, annual exams, and how important it is to have a good primary care physician. So first of all, as I mentioned, it's very important to have one physician that you go to who's your primary care doctor, that you see for your yearly physicals, that you see if you get sick, somebody who has a good sense of your history, your allergies, past medical history, family history, medications that you're on, so you don't get put on something that may interact with other things you may be taking. As far as primary care physicians, these physicians include internists, family medicine physicians, pediatricians, or dual boarded physicians like myself who are both internists and pediatricians. OBGYNs, a lot of people go to, of course, women, and they use them as their primary care physicians, but a lot of OBGYNs who I'm friends with prefer patients to also have a primary care doctor that they see, so that if anything comes up, so for example, if a person gets diagnosed with diabetes, usually the OBGYNs again would prefer you to follow up with your primary care doctor instead of them regarding those issues. So a closer eye could be kept on that, because OBGYNs went into their field because they like taking care of women's health. So if you're already bored by me saying, hey, get your physical every year, let's take a look at what happens when people are bored. Alright, isn't he so cute? So I know you're probably already yawning, because I know if you already have a physician, they always remind you and we urge you about getting your screening test done and making sure you get your checkup. So I'm just reiterating that point. So these preventative care visits and annual physicals are very, very important. So for example, with kids who see their doctors, these are what we call well child checks. And when babies are initially born and when they're younger, these well child checks occur more frequently. So for example, after they get out of the hospital, at 2 weeks, 2 months, 4 months, etc. However, as kids get older, so for example, like 4 years or 5 years, then it gets spaced out to an annual visit or an annual well child check. So if you have a child, don't think it's that horrible because now that they're smaller, you have to see us so often. It will get better, I promise, and your child or children will only have to see the physician once a year for their checkups. But these are important because these are times that you can talk to your child's doctor about things like shots, developmental milestones like walking, speaking, using a fork and spoon. Other things that are important is interactions with other children. These visits serve also as a screening tool for us for things like iron deficiency, screening for lead levels to make sure that those aren't high, also things like autism screening. So again, it's very, very important to keep these visits. Plus it helps the doctor see how your child is progressing. In addition, as I mentioned, you can also share any concerns that you have with your physician and ask any questions. On the adult side, annual exams are important too, because this is a head-to-toe checkup. Also, some doctors will do a skin check, so if you have any concerns about any moles or if there's any family history of any skin cancer such as melanoma and you have an issue or a skin lesion that you want them to take a look at, they can do so at an annual physical. If need be, you may be referred to a specialist such as a dermatologist or a plastic surgeon or sometimes even a general surgeon. At these visits too, most people will get some blood work. A lot of times it's what we call fasting blood work. And this includes things like your sugars to check for diabetes, your cholesterol level to check to make sure that all of that looks good, that you're not eating too much fried or fatty foods. In addition, we check your kidney number, liver number. Sometimes, if appropriate, we will check vitamin numbers in addition to the other labs. And of course, if you bring up any other concerns, your physician may add some other blood work if they see fit. In addition, this is the perfect time for your doctor to talk to you about screening tests. We had talked about colonoscopies for colorectal cancer. Some of these screening tests also include mammograms for breast cancer, bone scans or DEXA scans that screens for osteoporosis or bone breakdown, putting you at higher risk of fractures as you get older. Also, other things are PAPs, and of course, again, you can get that at your OBGYN. Again, at these visits, it's also important to address any concerns that you may have with your doctor. I always say to my patients, I know you don't like seeing me very often and only when you need to, but I always tell my patients one thing that I ask for is that you come at least every year, once a year, and get your blood work done. Again, I just want to remind you that these visits with your physicians, please be honest about your history and things like smoking and alcohol use, because this does affect your health, and it helps us in assessing you and making a plan for you and getting tests if you have certain complaints. So again, I hope this was helpful. Again, I hope this helps motivate you that if you don't have a doctor, that you'll go out there and get a great doctor. And if you have one, that you're calling right now to make your annual physical exam. And again, even if it's just once a year that you see your doctor, I'll give you credit for that. Again, happy World Health Day tomorrow. And what I want to tell you, the thing that no one told me was that for patients who have Medicare insurance, note that Medicare does pay for an annual preventative visit. So please contact your doctor's office if you have Medicare and ask them about your Medicare annual exam. It's a great screening exam for you, and you don't want to miss out on that opportunity. So I hope you enjoyed today's show and it helped you. Again, don't forget to make any comments on any topics that you would like me to talk about. Don't forget to wash your hands, kiss your kids, love your family, and say your prayers. Bye-bye.